Greetings, my name is David Wright. I'm a former Chief Executive of the Royal Australian College of General Practitioners. I've undertaken work in the Middle East for 4 years, working with the Bahrain Economic Development Board and also many governments in and around the Gulf cooperative countries. I've also undertaken work for the WHO and the European Commission. I first came across the work of DJ Hamblin-Brown when I was actually looking at quality improvement within hospital settings. And Careful has the potential to make a real difference in the situations of handover within hospitals. Quality improvement within health systems is very, very important. As you will hear from DJ's presentation, the numbers of medical errors, etc., can be improved considerably. And Careful has the potential to make a real impact within hospitals as well as other organisations that provide care to patients. I commend his work and the Careful product to you and look forward to hearing from you in the near future.
Hello, my name is Dr. DJ Hamblin-Brown. I'm the CEO and founder of Careful, a product that is revolutionising communication in hospitals. Some clinicians have called our product Slack for healthcare, but it's more than that, as you will see. Some years ago, a hospital very nearly killed my mother. Her care team forgot to use a chart to prevent fluid overload. She became so sick, it took her months to recover. And recovering from this simple communication error was not just painful for her and for us, the family, it was costly for the hospital. Now, shockingly, harmful events like these happen in between 10 and 14% of all hospital admissions everywhere, which means that you, like me, probably know a victim of medical error. In addition to the cost of patient harm, poor communication also causes waste of resources by causing delays in care. So getting patients into hospital is relatively easy. Getting them out the door needs complex coordination and planning. And hospitals manage this with inadequate manual and informal systems, sticky notes, whiteboards, handover sheets. It may seem extraordinary, but traditional electronic patient record systems, EPRs, just simply don't support this sort of work. And in the UK alone, delays caused by hospitals costs the NHS £250 million per year. So poor communication in hospitals is a huge problem. This is why my team and I have created the Careful platform. It's an SaaS product that allows care teams in hospitals to write down and check off all of the key tasks in a patient's care plan, and then importantly share and hand over those tasks both between individuals and teams so that nothing gets forgotten. Then, critically, with this information, hospitals can visualize what tasks are needed to improve patient flow and reduce costly delays. So Careful will reduce length of stay for hospitals, but also create a more efficient working environment for staff and, above all, provide safer care for patients. The overall market for electronic health record software is growing exponentially. Most growth will be within emerging markets, which are currently poorly served. Now, naturally, we have competitors, but what makes us stand out is that we are totally focused on task-based handover, which lies at the intersection between patient flow and clinician communication. Careful is also designed for product-led growth. It can be adopted initially by a single team and then easily shared across the hospital and even used to refer patients on to new customers. And that way the product mirrors medical collaboration. During its development, we've trialled this product in 4 countries. It's already translated into Spanish, and we are planning further trials in Bahrain, Singapore, and Australia. So Careful is scalable and has global application. And just to say, unlike most hospital systems, clinicians actually love our product. So income from customers will be on a recurring monthly basis or on an annual license of between $50,000 and $100,000. Now, importantly, Careful offers a compelling financial proposition. For a hospital with 100 beds, an average length of stay of 3 days and an average revenue of $2,000 per patient, a 3% reduction in length of stay generates $800,000 in extra revenue and 8 times ROI in the first year. Early on, we received an investment round from angels, primarily, which we used for product development. And thanks to Brinc, we have now just closed our second seed round. We aim to raise further funding in early 2022. We're lucky to have a great team of technologists and healthcare specialists with decades of experience working with such organizations as Microsoft and Apple and across insurance and private providers. For myself, I've been an NHS doctor since 1996 and was recently the chief medical officer of a 7-hospital system in China. We're also excited to have just appointed David Wright, the ex-CEO of the Royal College of Australian General Practitioners. So what I've just described is a product that will save thousands of lives and millions of dollars. A product that is ready to take advantage of the exponential growth in digital health records, and a product that can scale globally. We are committed to revolutionizing communication in hospitals, and I would be delighted if you would get in touch for a follow-up meeting. Thank you.